Everyone, thank you for being here today. Very excited to see how many people are in our session, hoping to learn more about workforce development and behavioral health. I'm very excited to share with you what we've done and maybe you can replicate or offer insights too. So very excited for this session. My name is Natalie Vickous. I am a program coordinator at the Trager Institute, working closely with our BHWET Paraprofessional program that we're going to share more about today. And I'll let my co-presenters introduce themselves as well.
I am Dayn'l Beeler. I am a program coordinator also at the Trager Institute, working with paraprofessionals.
Hi, and I'm Miceli. I'm program coordinator with the Trager Institute, and I work with the paraprofessionals, but more on the side of the community health worker apprentices.
So just to start us off, we are funded by the Behavioral Health Workforce Education and Training Program grants from HRSA. So this is our, not disclaimer, our sharing. And we actually have two different BHWET grants. So the first is our professional grant. We've had that for, I believe, 2 cycles. And that one really funds the practicum and training experience for professional students, so bachelor's and master's level students, mainly in social work, who are doing their practicum placement with us and learning more about trauma-informed care and interprofessional teams of care. And then our BHWET Paraprofessional grant is intended to develop and expand community-based experiential training to increase the supply of students preparing to become peer support specialists, community health workers, and other behavioral health related paraprofessionals. So really increasing the number of people who are qualified to work in behavioral health without kind of having to reach that educational level of that professional grant. So I want to share a little bit about our kind of recruitment and community engagement, the starting point of our paraprofessional program. And later you'll start to see it all come together. We're going to share different pieces with you. But when we think about recruiting for our paraprofessional program, we intentionally make connections to recruit from organizations that are already serving the populations that we want to reach. So those are traditionally underserved, including women, minorities, Spanish-speaking, and lower SES. And then each approach is tailored to speak to the benefits that work with that specific population, the ways that we're going to best support that population and what they can gain from participating in our program. So really thinking about the supports, the wraparound services that we incorporate to ensure the success of diverse populations, recognizing that every group's needs for support and engagement are going to be different. So we do our best to really speak to that. So we have over 35 community contacts, including adult education centers, community centers, rehabilitation and recovery programs, and military and veteran groups. And specifically, we see a lot of engagement from rehabilitation and recovery programs because traditionally the people who want to become certified and work in behavioral health are the people who've been helped themselves. So they really feel that desire to give back and help others in the ways that they've been helped. And so we see a lot of engagement from that area. We really try to work in reciprocal approaches to our recruitment. So whenever it's possible, we either refer our learners or participants back to these organizations for services and programs that they provide. One example I can think of is Kentuckiana Works offers career readiness training. And so using them to help our paraprofessionals work on their resumes and their interview skills, and then really kind of feeding back into the programs that they offer. Or we even attempt to partner with them as an apprenticeship site. And Chelsea will talk about that a little bit later. But thinking about if we recruit someone who's referred from an organization, how can we then give back to that organization? Can we send them back as a trained paraprofessional with certifications to serve through the organization? Can we use the services that they offer? So really trying to build a beautiful pathway that's kind of feeding back into the community that we're pulling from as well. We do have some requirements for participation, and we've worked really hard to get clear language about those in order to make sure that we're not re-traumatizing people. We don't want to offer hope for certifications or participation and then have that kind of fall through. That's not how we operate. We really are a trauma-informed organization. So to participate in the program, individuals do have to be a citizen, national, or permanent resident of the United States. They have to have a high school diploma or GED, and then they have to have a background check with no charges that could interfere with their ability to successfully complete the program. So we do have experiential components that Dayn'l will share about, and it's important to make sure that they can complete those experiential components even with charges on their background. So we really try to be thoughtful about making sure that they're eligible for every piece of that before we accept them into the program, making sure that they can complete as far as they want to complete. I will say that, with a high school diploma or GED, some people might assume that that means our cohorts are very young, and that's not always the case. So we all know that that could look very different. It could be someone who is recently graduated from high school. It could be someone who just earned their GED later in life, or someone who has had their GED or diploma for a long time, but they're going back for a second career or rethinking the ways that they want to interact in behavioral health. So we really do have a lot of even age diversity in our cohorts. And then at the time of this presentation, we have had 76 interest surveys submitted for our third cohort, which is starting in fall 2023. So just to share a little bit about our application process, it's detailed. It's built to ensure that learners are making an informed decision when they apply to the program. So it starts with an interest survey. That's that 76. It's very quick and easy. They submit that, and that prompts them to attend an information session where we share, actually the next slide that I'm going to share with you. We have those scheduled throughout the application period at different days of the week, different times of day to fit different schedules of availability. And at that info session, we share an in-depth dive into expectations, requirements, really, letting them know what they're going to be getting into, as well as sharing the benefits of the program, what they can expect to get out of it. And then they're invited to apply if it feels like a good fit for them. And so that was a change from our first cohort when we shared that information with individuals after they had already applied. And we realized that many of them had applied to the program without knowing what they were applying for. And so when we made that small change, just a little shift of having people do an interest survey and attend an information session before they apply, we actually resulted in a 15% jump in retention from cohort 1 to cohort 2 in the pre-apprenticeship. So really, that kind of affirmed for us that it's a good process to let people make an informed decision as they apply. And so then after they apply, they're invited to Zoom interviews with our team. Then they complete background checks before receiving an offer with notice so that they can adjust life as needed, whether that means getting childcare, talking to employers, etc., doing whatever they need to do to make sure they can be successful. So this is our stair-step slide. We use it to really highlight every piece of our paraprofessional program. And a lot of it I'm going to kind of jump over because Dayn'l and Chelsea are going to share in more detail about their specific pieces. But I just want to note a couple of things here for you. So in our paraprofessional path, you can see that over here on the right, that's where our professional grant lives. That's where our professional students are. And that's where Trager was for a long time and how we engaged with training learners, because we only had that professional grant. So we trained these bachelor's and master's level students and offered them really an insight into trauma-informed care and interprofessional teams of care and caring for older adults. So really diving into a population that doesn't receive a lot of attention in social work and behavioral health. It's not always kind of the favorite path for people to pursue. So that was great. But we started to think about the fact that when we were engaging with those learners, we were engaging with them kind of at the end of their learning journey. And I always laugh to say that because we're never done learning. But they were about to graduate. They were about to seek out licensure, and supervision and really be done with that piece of their learning. And so with the paraprofessional grant, we started thinking about what if we engaged with people much, much earlier in that learning journey and supported them throughout it? What if we engaged with people who maybe think they might want to pursue behavioral health but aren't really sure how, maybe haven't had traditional access points to college or to certifications or work? What would it look like if we brought them into behavioral health and engaged with them? And so that's where our paraprofessional program was born. So starting over here with the pre-apprenticeship, we recruit 21 individuals for each cohort. We have a cohort that starts every year in October. So 21 in each cohort, and they're with us for 6 months from October to April. And so, as I mentioned, they have to have that high school diploma or GED. They can have some college credit, but it's not required. And when we think about only taking 21 in each cohort, it does become pretty competitive. And so we really try to give priority to the people who haven't had those opportunities. So definitely no one who already has a degree in behavioral health, but really looking at people who haven't had those access points. How can we support them in getting to certifications, getting to work, and then potentially getting to degrees if that interests them? Dayn'l is going to share more about the classroom learning curriculum and the experiential learning. So what I will share is that we don't have any cost to our program to participate apart from their time, reliable Wi-Fi, and transportation for their experiential components if needed. But we do support them with a $5,000 stipend, and that's paid out across the 6 months that they're with us. That goes directly to them to support whatever they need. Many of them use it to get a more stable Wi-Fi connection to engage in training. They may use it for gas money or to help with childcare, things that they need to be successful in the program. So we provide that to make sure that they can really engage with us. We also provide them with a free laptop at the start of the training. And as long as they complete the program successfully, that's theirs to keep to support them in continued learning. And again, Dayn'l will talk a little bit about what we've learned from using those laptops. So if they have lived experience, they can earn that support specialist certificate. And what we found, again, as I mentioned, when I talked about recovery centers really engaging with us, is that people are coming to this program because they want to give back in the ways that they've been helped. And so what we found could be a positive, could be a negative, could be a mixed bag, right? Is that everyone has that lived experience that qualifies them to earn an adult peer support specialist certificate. The world we live in, many of us struggle with trauma, mental health, substance abuse. And so we are seeing people who are engaging with this program and coming to us because they have a desire to help others get through what they've gotten through or similar situations. And then Chelsea will take over and share more about the apprenticeship and that placement, but I'll just share that out of our 21 in the pre-apprenticeship, only 11 are selected to move on to the apprenticeship. And we do see a lot of people self-select out. They may say that they are not in the right place or time in life to be in an apprenticeship. They may be ready to jump straight into a bachelor's degree. They may use their new certifications from the pre-apprenticeship to leverage for promotion at their current workplace. So we've seen a lot of these things happen. They may also say, you know what, I've tried out behavioral health and now I know that it's not the right fit for me. And while that's disappointing, it's also great because it means that they're not spending a lot of time and money pursuing a field of work that isn't going to be a good fit for them. And that's the beauty of workforce development and experiential learning. So they continue their engagement with us in training during that time. They earn some certifications that Chelsea will share more about. And then they also still receive a stipend throughout that year. So $7,500 paid out across 12 months, again, to help support them in pursuing their training with us and accessing it in all the ways that they need. And then ideally after their apprenticeship, they stay with their employer site, but that's not always going to work out that way. The employer may not be able to keep them. The apprentice may not want to stay in that placement. And so if they aren't staying at that employer, they're ready after that year for employment in the healthcare field. They've gained their certifications, they've gained their training, and honestly, they've gained their year of experience, which is often the biggest barrier to starting out in a new field of work is applying for jobs and having to already have experience. So they've really gotten a good foundation to explore employment in the healthcare field. And then maybe they come back to where we started with the bachelor's degree. We offer connections. We help them meet with academic leaders in organizational leadership and learning with counseling psychology track or the bachelor's in social work at U of L. Both of those are offered on campus or fully online for our remote learners. Because I should share that this is a program built to serve all of Kentucky, specifically rural and underserved areas. So many of our learners would have to engage with those programs online, which is why we wanted to highlight those programs specifically. And that's also where we see them express an interest in pursuing continued learning. And there is an opportunity with the Bachelor's in Organizational Leadership and Learning to Transferring credits, sell your prior learning in terms of what you've already learned through life or through your certifications that can kind of count as credits towards your degree. And that really helps by taking some of that tuition money off to ensure that that bachelor's degree is as accessible as possible. And so we're hopeful that in the future, maybe we can do something similar with the bachelor's in social work as well. And then if they decide to pursue a master's degree much later on, then maybe they do their practicum with us and maybe they receive a stipend during that placement as well. So it's a beautiful pathway. I do want to share that it's not prescriptive. Okay, so you don't have to go A, B, C, D, right, in order to engage with Trager. We really appreciate that everyone is coming to us from different places in life and different situations. And so we try our best to support them wherever they are and whatever they need. The only pieces that really hinge on each other is that to do the apprenticeship, you have to do the pre-apprenticeship. And that's because we don't recruit apprentices, we recruit pre-apprentices. So I like to tell them that they're with us for a 6-month interview for that apprenticeship if they're interested in it, because we're really making sure that they have that foundational training to then do well in an apprenticeship placement. So I'm going to pass it over to Dayn'l and allow her to share more about our pre-apprentice curriculum with you all.
Yes, so I work with the pre-apprentices in the program. I facilitate their training, so they do gain a Kentucky Family Leadership Academy certification, and they also work toward their Adult Peer Support Specialist certification. So we start in October, and then we go through April. They are able to take December off just for holidays and all the confusion during the holidays. So they get to take that time off and then work through April. So from October, November, we work through the Kentucky Family Leadership Academy. And then January through April, we work toward the Adult Peer Support Specialist certification. So right now we have 23 learners in cohort 2. Each learner is assigned a professional student mentor who checks in with them weekly. So like we have a Master's of Social Work student that is mentoring 2 of our pre-apprentices. So that student will work with the pre-apprentices through, every week and see how they're doing, how the program's going for them, if they need any guidance, just someone to lean on. So the learners earn their experiential hours through many different ways. So they can shadow their mentor or other students who are social work students. They can shadow them. They go to case conceptualizations with our professional students. So every Wednesday we have those, and a case is presented, and we come together interprofessionally and give resources to whoever's been presented, the patient that's been presented. They are able to do cognito modules, which are like a virtual training where they kind of put themselves in a place of a social worker or like a professional. And in this training, it will ask questions, and the learner has to answer the questions in the way they feel like it will go, which kind of gives them a little more, what is the word I'm looking for? A little more practice, you could say, to be able to work one-on-one with the individual. And then they have other online trainings. So they participate in a lot of the trainings that we have through the Trager Institute with our professional students, and some trainings that they are able to do on their own. Next slide, please. So just to kind of jump in for the employer recruitment and career readiness. So career readiness is what we do. A lot of it is what we do in that first 6 months. So with those laptops that they get, they gain a lot of computer skills. So many people, where we wouldn't think about it, do not have those skills because they don't own a computer or a laptop. So that laptop helps them to gain those computer skills. We do resume building. So they'll have someone review their resume. We practice interviewing. So just a couple of weeks ago, our pre-apprentices, they did mock interviews with one another. We do role-playing activities where they go in and one person is the professional and the other person is the client, and they role play. And then again, the experiential hours through shadowing, those case conceptualizations. We have Project Echoes that they can attend. We have My Health Matters, which runs every Monday from 6:30 to 7:30. They're able to attend. They are able to attend those. They have been able to attend other online trainings to get those experiential hours also. And that kind of helps them to build the skills they need to move on to the apprenticeship.
And so I myself had the same question when I started working with community health workers. What does that look like for someone in the community? What does that look like for a provider? And so who's hiring community health workers in Kentucky and at what rates? And then what are the benefits of an apprenticeship? And those are questions that Natalie, myself, and Dayn'l answer a lot of times. And we talk with a variety of providers. So whether it be insurance, primary care, behavioral health, substance abuse treatment, we're trying to figure out how we can get community health workers everywhere. We've essentially seen the benefits of having community health workers and the role that they're playing between the organizations and the clients or patients. So you can go to the next slide, Natalie. So it's been found for employers that for every $1 invested in a community health worker, that $11.34 is saved. And so we're in the business of profit, right? And so that's something to keep in mind. 86% of apprentices are retained for full-time employment at their apprenticeship sites. And as we all know, the hiring across the country, there's issues around hiring. And so the apprenticeship program is a great way for individuals that have a new skill set to enter into that workforce, and not just enter into it, but have the potential for longevity in the workforce. So for our apprentices, they're getting a year of experience while earning valuable certifications. And that goes back to that longevity and keeping them in the workforce and opening their eyes to all the different options in behavioral health. It also includes sick time, vacation time, and healthcare benefits, which is huge for a lot of our learners because that's not something they're very familiar with. Many of them have had jobs where they didn't have such benefits. And it's also an opportunity to grow within a cohort of individuals that are succeeding, and they're bringing the same energy and motivation together. We see that a lot in our Wednesday workshops, how much of a support they are for one another, how they can use each other to brainstorm community resources, how to navigate difficult clients. These are all things that we want them to bring to our Wednesday workshop when we're discussing different topics, and be able to build off each other. Because as we know, the field of social work really is about being social and relying on resources and getting out there to know what's available. So I have seen there's definitely a camaraderie amongst our learners, and that's something I really appreciate. So for the apprenticeship, right now we have 7 trauma-informed community health workers, apprenticeship participants, and I always say the apprenticeship, we're kind of up in the ante. So they've got these certifications, they've got the adult peer support, they've got the Kentucky Family Leadership Academy. Now we're really hitting it home and trying to take all those skills that we've learned in that first pre-apprentice phase and taking that to the workforce. And for many of our learners, like we've said, the whole workforce and professionalism is a new component that they're trying to learn and hone. And so something as simple as how to write a professional email. What is a professional dress code? What is professional and organizational, how to navigate organizational change, for example. These are things that we really discuss as a group, along with the community health worker curriculum. But there's the workforce behind that we really try to hit home, and how to be a good employee, what that looks like. including how to best benefit your organization. And so we've seen a lot of success in that in our learners. We have weekly, that's a lot. We have monthly supervisor roundtables where the supervisors of the apprentices will come and we brainstorm new ideas, how to use community health workers, questions and concerns. And across the board, they've said how much the role of community health worker has had an impact on their organization for the good. So we have, like I said, 7 trauma-informed community health worker apprenticeship participants right now. We're actually about to get cohort 2 in with our group. And so those numbers are going to grow exponentially, really. I think we'll be at 20 some within the next month and a half. We have non-certified community health worker apprentices. And for those that aren't in Kentucky, that is a state certification. They apply, they prove their curriculum, and from there, they're awarded a certification. And then we have 2 certified Kentucky certified trauma-informed care community health workers at the Trager Institute. And yes, it's a mouthful, but we really wanted to make sure that the trauma-informed was the approach we took. That's the backbone of Trager, is trauma-informed. And so we wanted to carry that over. And really, we were kind of ahead. Natalie says it best. We were ahead of the curve. We were already putting trauma-informed in our curriculum. And now the state is going to be requiring a component of trauma-informed care for community health workers. So they're going to get a double dose, but that's great because we can never have enough, right? Right now, our employer sites for our apprentices include Volunteers of America, Mountain Comprehensive, and the University of Louisville. And Natalie said this, but so this is statewide. So I'm in Southeastern Kentucky, and I train from Southeastern Kentucky, but we have learners up Eastern Kentucky, up through Pikeville, and then the Louisville Metro. And of course, we're always looking to expand that to South Central Kentucky, Eastern Kentucky, the Metro. There's high needs in all of these populations. And so, yes, that we meet with employers, we meet with primary care, like we said, even insurance companies. How can we get these community health workers into the field, and where do they fit well? Go ahead, Natalie.
Chelsea, before we move on, there is a question in the chat that I think we can speak to.
Yeah.
Bev asked, what agency does our certification?
What agency does our certification? Okay, so we are working to become, the state has changed within the past 6 months, has changed to become what we could say, there's a trauma-informed community health training organization. And so right now we are working on the curriculum with the state. So our goal is by summer to become a certified training organization. So we, myself, Natalie, Dayn'l, other Traeger staff are also becoming certified trainers. So it's twofold. We'll be certified trainers, and then we'll also be a certified training organization.
Yeah, absolutely. So it's always changing. We kind of laughed when we made these slides because they're very bare bones, but I feel like things are always shifting and evolving, which is exciting. But we offer our curriculum for trauma-informed Flourish Care community health workers. And we actually had, so far, all of our cohort 1 participants were approved by the state through the previous certification process.
And so the value of community health workers, and this is the best way I know how to put it, and this is how I put it to the learners. They're essentially a brand new social worker trying to figure out the field and navigating it, because a lot of them fill into that role. Not as a credentialed social worker, but they use the same tools as social workers. The things, before I took this position, the things that I used in the field all the time, these are the same things that we're seeing our learners do on a daily basis. So again, for the organization, in red, you'll see what are the community health worker competencies. And so this is what the foundation of the curriculum. And this is what the state looks at as far as making the organization a certified training organization. Are we teaching these materials, and are they able to exhibit these behaviors? Are they able to pass the competencies in the field? And so that's what the state's looking for as far as certification. So communication, Again, and that goes back to the workforce development. What does communication look like with your peers? What does communication look like with your clients? They can attend community health fairs, and we have that a lot. We have some of our organizations that do cold calls, some that go door to door and do door hangers. So it really, communication all across the board, they all do it in different capacities. And these are just examples of some of the things that they can do. We've learned since then, the role that community health workers have taken in organizations is beyond what we ever thought it could be, truthfully. This is just a very simplistic view of what it is, but the reality is it's pretty extensive. The use of public health, plan or share information to address community health and mental health issues. We see this all the time, and it kind of goes hand in hand with the organizational and community outreach. Most of our organizations require their community health workers to complete screening tools for their clients. So some it's the prepare tool, others it's an organization-based assessment. What are the needs? Essentially, they're checking what are the needs and how can we address them. And it's the role of the community health worker to address those needs, whether it be a behavioral health referral, whether it be a call to DCBS, whether it be a referral to substance abuse treatment. Advocacy and community capacity building, we see this. There is, especially in the Louisville metro area, there is a email chain. And I think Bev's on here, isn't she? Yeah, okay. So all day I see the community health workers, and they're reaching out to one another, and they're saying, I have a patient that needs a hospital bed. What can I do? I think it was last week, I have a client that needs to take a shower somewhere. They're bedridden. Where could they go? And so that really goes to one, it hits home to the advocacy and the community building, because that's what it is, all about networking. How can we best serve our clients? And that's what we really hit home for the community health worker. And it means extending yourself out to such an email group saying, what are my needs and how help me address them? We have a lot of VOA specifically monitors clients and evaluates their treatment process a lot as they work with Humana. That's an important component to the insurance that the community health workers bill or fall under. Health coaching, again, back to what are the social determinants of health and how can we address them? What areas do we need improvements in? Documentation, reporting, and outcome management. And that goes hand in hand with the legal and ethical and professional conduct. This is a whole new field for a lot of these learners. They've only ever been on the receiving side of it. And so them understanding the steps that are being taken by a case worker or a social worker, they can now say, I've been in this situation and I wondered why they asked me that. And now they're able to take their experience and apply it to working with others. These are really, we hit home on these, and we really rely on the organizations to make sure to tell us, like, what documentation, how can we best train them? And for example, in that supervisor roundtable, one of the organizations said, we really need some follow-up on the teach back method. So we went and we put that into the curriculum. How can we better prepare the apprentices for what they're going to be doing on a daily basis at their employer site?
Yeah, thank you, Chelsea. And to build on that, we didn't put in a slide with a timeline and numbers, and we should have because they're really impressive. But hindsight's 2020. But we are in the process now of placing our second cohort of apprentices and recruiting our third cohort of pre-apprentices. And so we've really seen kind of the full cycle with our first cohort of apprentices. They went through pre-apprenticeship into apprenticeship placement. We've been with them for a few months now, and we kind of saw the certification process, what that looked like. So we're able at every stage to take the feedback that we're getting from our learners, from our employers, from our staff who are working in the program and saying, this is not working. And we're able to take it and incorporate it to make sure that we're improving it for the next cohort that comes through. And so it really is a beautiful cycle of just constantly learning and improving. And our learners have been so fantastic so far. It's amazing to see the ways that they just really jump in, apply what they're learning, engage with the apprenticeship opportunities, or using their certifications in other ways. So it's been a really beautiful program to be part of. So that is actually all
And
that
I
we
was,
plan to
sorry,
share. Yeah.
I was going to add one thing back. I didn't want to interrupt you before, but so of our first cohort and our second, we have had 3 that have applied for a bachelor's program. So when Natalie was saying the path isn't prescriptive. So in our first cohort, we had one that automatically, she had finished the paraprofessional part and said, I want to get my bachelor's. I want to be a social worker. So she was accepted to the University of Louisville, and she will actually start her practicum with the Trager Institute in the fall. And so that's just a perfect example of that pipeline. And then since then, we've had 2 others be accepted and a 3rd has applied. So just what that can look like. I know, for example, we have an individual that's one of our learners is placed at the University of Louisville Physicians, and she works in one of the specialty departments. And her supervisor there has been extremely supportive. And she was like, I want to go back to school. They're willing to work with me. Is the program okay with me going back? Would you write a letter of recommendation? And we're here for all of that. That is ultimately the goal. Doesn't have to be a bachelor's degree, but whatever path they want to pursue, we want to support them in. So I just think it really speaks volumes, especially to the higher education, what all is occurring.
Absolutely. Yeah, thanks, Chelsea. So, I mean, at this point, if anyone has any questions, please pop them in the chat. We would love to have a conversation about this. This is not how we usually present. So we usually are more of a conversation model. It's a little bit difficult in this platform. So we would love to answer any questions that you have about specifics of the program or building it, application. And I believe you might be able to unmute to ask a question too. Kiara, please correct me if I'm wrong there. Thank you, Bev.
Sorry, my mouse was acting wonky there. Hold on a second. Yeah, there's no questions.
I think, Natalie, I'll speak about this. So in Kentucky, community health workers, it was decided by the legislator that community health workers will be billable under Medicaid. My understanding is that as of July, we're looking at July timeline as far as what billing codes will look like and reimbursement rates. And so I think that's important to note, because a lot of the people we meet with, as far as for an apprenticeship site, they're like, how do I get funding for this? The funding is coming. So just keep that in mind, especially if you're interested in this and want to take it back to your agencies or your organizations. In Kentucky, I can't speak outside of that, but in Kentucky, the funding is coming. They're still navigating that with Medicaid in the Center for Medicaid Services, but it is coming. And so I want you to know I see the field of community health workers growing. There's going to be a set number of reimbursement codes right now, but there's no telling where that could go. Once they see them out into the public, what they can do, the role that they're playing, I feel like that will also change.
Yeah. Yeah, Bev, that's a good question. She's asking about how does word get out to the public about our program. So we have, as I mentioned at the start, we have our community partners that we kind of engage with and share about our program. We give a lot of this information to them, and we ask them to identify any individuals they know through the programs they offer or their services who might be interested or eligible. And so we do receive quite a few applicants that way. What we found being in our recruitment for our third cohort, which is kind of beautiful, is that we receive now a lot of referrals from people who know someone who participated before. So especially in those recovery programs, there are people who engage with it, who love the format of the training program and what they're learning, and they're telling all of their friends about it. So then we're receiving people who are saying, oh, so-and-so told me to apply. They thought I would really enjoy it. So it really has become a very organic process. So we're still constantly doing that outreach to community partners, especially again with populations that we really want to make sure we have represented in our cohorts and in social work in general and community health work in general. So we do make those very specific and strategic contacts, but we also have people who are learning about it through a friend of a friend or a family member who participated. So it really has kind of taken on a life of its own when it comes to recruiting. So I did share that we're in our third recruiting cycle. It is still ongoing. So if you can think of someone who you think would be a good fit or might be interested, please take note of my email on this slide. I'm always happy to share the application link and more information about it. You can also find more information on our website. I forget the exact link though, so maybe email me and I'll send it to you. But I'm always happy to share that. We are accepting applications until June 1st for the fall start cohort. So always happy to have more people applying who are interested and maybe a good fit for the program.
And like Natalie was saying, our recruitment process, as everything evolves, you know, we've recently started discussing how could we kind of target maybe technical vocational programs, those that are already familiar with apprenticeships. How can we get into these high schools and do recruitment for those that are graduating that may not be sure that they want to go to college just yet, but this could be a good middle ground for them to get their feet wet, to see if they like behavioral health without having to take the full dive into it. So we constantly are brainstorming and coming up with new ideas, new target populations. So if there's ever anyone that you all want us to speak with, an organization in the community, we would be more than happy to meet with them and kind of let them know about the apprenticeship.
Absolutely, yeah. And yeah, thank you, Bev. Our screening process, again, like everything else, has evolved, but I think in very good ways. And like I said, when I calculated that retention jump for this presentation, I was so excited to be able to share. I mean, 15% increase in retention is huge, especially in this type of program. So I think it really speaks to the fact that the way that we're recruiting and getting people into the program is working, and we're getting the people here who want to be here and who are self-motivated and committed to staying and improving their training and education. So yeah, we love getting in the school systems, especially adult education, vocational programs. So as Chelsea said, if you know someone who you think might be interested, please contact me. But also if you know a group that I should speak to about this program, please contact me. I would love to set up a chat with any groups in your community that you think might be kind of good referral sources for us. You can never have too many contacts. And the same goes for anyone that you think might be hiring community health worker apprentices. Chelsea and I would love to start a conversation with them as well in high school. I will make a note of that. Thank you, Bev. Any other questions? If not, this will just be my fully shameless plug that I built a beautiful scavenger hunt. They're amazing prizes. There's still plenty of time to win. You just have to submit by noon. So if we're done in this space, you have time to go visit the exhibit hall and do the scavenger hunt, please. Definitely you want to win these prizes. So please take some time to explore our exhibit hall and our sponsors and exhibitors who are supporting the conference. And complete that scavenger hunt so that you can be entered to win a prize. And thank you all for being with us.
Yeah, thank you all. Sorry, Natalie, I didn't mean to cut you off.
We know you had a lot of great choices today, so thank you for choosing us.